A very good afternoon to all our panelists and audience who've joined us today. I am Amba Vatil from the Council for Strategic and Defense Research, a foreign policy-based think tank in New Delhi. I welcome you all to the CSDR Chintan webinar on air pollution in India, opportunities and response challenges. Today, we have a wonderful discussion planned on a critical issue which, despite considerable attention, continues to pose problems across policymaking and implementation stages. Without wasting any more time, let me quickly introduce our expert panel. Our session today will be chaired by Ms. Bharti Chaturvedi. Ms. Chaturvedi is the founder and director of the Chintan Environmental Research and Action Group, an organization that focuses on issues of urban poverty, consumption, and sustainable livelihoods for those working in the informal sector in India. She has previously received the globally recognized LEAD Fellowship and is a fellow at the Synagogue Institute, New York. Bharti serves on the board of several organizations and has won awards for her work. In 2015, Chintan won the UN Climate Solutions Award at COP21 Paris. Bharti also writes a popular column for the Hindustan Times, Greenpeace. So the next panelist is Dr. Abhinaya Shekhar. Dr. Shekhar is currently a consulting research fellow at the Health Effects Institute, New Delhi. She's a senior research associate at CPI's initiative on climate, energy, and environment. Her research focuses on enabling policymakers to make better policies by centering science in air quality governance. We also have Ms. Tanushri Ganguly. Ms. Ganguly is the Director, Air Quality Life Index at Energy Policy Institute at the University of Chicago. Her career efforts focus on strengthening data-driven air quality decision-making and unpacking challenges in implementing national-level policies at local levels. She has also worked as a researcher in New Delhi. Another panelist that we have today is Mr. Sunil Dhaiya. Mr. Dhaiya is presently an analyst at the Center for Research on Energy and Clean Air. He has over 10 years of experience as a strategist and research analyst on environmental issues. He led the energy and air pollution campaigns at Greenpeace India, which resulted in development of larger civil society momentum. With that, I once again extend the warmest welcome to our panelists. All our speakers are welcome to deliver the opening remarks. This session will be moderated by Ms. Chaturvedi, and each of our panelists have around 5 to 7 minutes for the opening remarks. And now I will hand it over to Ms. Chaturvedi.
Well, thank you so much. And thank you to our panelists. It's a glorious Friday afternoon, and people might wonder, what are these four people really doing on a Zoom link on their laptop screens when finally, the deep winter seems to be over. And I think that's why we're all here. We're all asking and we're all considering the question that air pollution is just not a winter problem. And that's what makes it so important to discuss just at the time when it's getting out of the news, when it's actually becoming less of an issue than it used to be just, 2 months ago. And I think what we're finding, and I'll just say a few things before we start this. First of all, I find air pollution, for example, in Delhi, according to a parliament response, the first clean air day was really on the 10th of September last year. And the AQI was 45, 10th and 11th. But actually, those were very freak days because it was raining and raining all night. So yesterday, the Central Pollution Control Board said that it was one of the cleanest Februaries, not yesterday, actually, day before yesterday. And they announced it yesterday, one of the cleanest Februaries. But then, and even that wasn't in the green zone, it was in the yellow zone. But it was due to wind direction and wind speed, really. So one tends to think that if we didn't have, if geography and ecology and weather patterns didn't have some bearing on this. What kind of air would we be breathing throughout the year? And it's kind of more serious than we tend to think of in our everyday lives. And that is because, firstly, CPCB actually says, the Central Pollution Control Board, that you shouldn't actually have more than 2 consecutive bad air days. But we have very, very few, and Sunil Daya pointed this out, clean air days, first of all. And so we're actually doing quite the opposite. The other problem is that we also know that in India, health is very severely impacted. I won't say much because Dr. Sekhar is here, but there is 60% of Indian cities have air which is 7 times worse compared to WHO standards, which is like higher than Indian standards, but it's important to note 7 times worse. And I think what the question we'd like to ask really is that we have NCAP. We have, of course, huge citizens traction. We have so much data. The CPCB is on it. The 15th Financial Commission really earmarked so much money to urban local bodies, notwithstanding the fact that many times it's a regional airshed issue, but nonetheless. And on top of that, we actually have a lot of other kinds of data that are telling us what are the sources of this. So why is this not working? Why are we breathing substandard air through most of the year? This is no longer a winter problem, and that's what we're here to discuss. So, Dr. Sekhar, over to you. Hello?
Yeah. Good evening, everyone. Thank you so much, Amba, for the introduction, and Bharati for setting the context. And it's an absolute pleasure to share the panel with Tanushri, Bharti, and Sonal, who have contributed significantly to the field and served as a true source of inspiration. So let me share my screen. Is it? Yeah. So today I'll be is it okay?
Yeah, it's
Yeah.
okay.
Yeah, so today I'll be presenting air pollution in India from a health perspective. So this is the outline of my presentation. Firstly, I'll be covering the status and statistics of like exposure and disease burden in India, followed by what all the available evidence that we have in India and how those health evidences can be integrated for the policy making purpose. So to start with, all the data that I'm presenting in the first 2 slides are from the Global Burden of Disease Study 2019. In the figure, the first image, figure A, shows the exposure to outdoor PM 2.5 measured in terms of populated weighted average, and figure B shows the proportion of population using the solid fuels, indicating the household exposure. So in figure A, we can see that the concentration is very higher in the northern states like Delhi, Haryana, Bihar, and Uttar Pradesh. And with coming to the figure B, around 56% of the population in India are dependent on solid fuel for cooking, and in which 6 states in eastern and northern part of the country, around 70% of the people are dependent on solid fuel for cooking, which indicates that the emission from the residential cooking and heating also contributes to air pollution in India. And coming to the health data, in the year 2019, around 16.7 lakhs deaths were due to air pollution, of which nearly 10 lakh deaths were due to outdoor PM 2.5. And among all the air pollution deaths, 18% were from children under 5 and 20% from adult over 70, indicating these 2 groups are highly vulnerable. And in the same year, air pollution contributed to more than 1 lakh deaths among the infants who were born in the first month of their life, that is during their neonatal period. So how does this air pollution affects our health? So coming to the exposure perspective, we can divide exposure into 2 types. One is the short-term exposure and another one is the long-term exposure. The short-term effects indicates the effects within few hours or days of exposure. To explain you from the Delhi standpoint of view, exposure to higher level of pollution during the intense pollution period like the winter pollution episodes, Diwali, dust storm, and others. And even it causes effects like ear, nose, throat irritation, and aggravate your symptoms like allergic and asthmatic symptoms. In fact, a short-term health effects study conducted in Delhi have shown that increased risk of death among the elderly adults due to exposure to PM 2.5. And coming to the long-term exposure, this indicates it is a prolonged exposure of polluted air, which leads to chronic health effects like cardiovascular disease, respiratory disorder, premature death, and it reduces the life expectancy also. So, due to continuous inhalation of pollutants, it highlights the cumulative health effects of Delhi's persistent air pollution. And if you ask me where health is brought in for the air quality management, I would think of two things. One is the National Ambient Air Quality Standard, and second one is the Air Quality Index. So currently, one approach where I can think of that health frame is incorporated is the implementation of GRAP based on EQI. But the efforts to mitigate the pollution and GRAP under GRAP should be acknowledged and appreciated. But however, there are two issues associated to it. Firstly, is the scientific backing of the measures that are being taken, and secondly, is the health breakpoint itself. So global studies and Indian studies have shown that exposure response function. What is exposure? So if you assume this is the exposure to PM 2.5 and this is the health outcome that you may face, risk that we face. So the risk increases at the lower level of exposure, for example, 20 microgram per meter cube, and it steepens when the exposure is increasing, indicating a significant increase in the health risk. For example, let it be 50 microgram per meter cube, and the curve flattens after some time, be it 100 microgram per meter cube. So here the measures are being taken only when the air quality reaches very poor or severe level. So reduction, like if implementation of GRAP can help you to reduce pollution from severe to very poor category, then the benefits that you will acquire will be very less. So to achieve a significant health benefit, we need drastic reduction of air pollution in the city. So one thing that we keep listening is that we don't have enough evidence that shows air pollution affects health. But nowadays, there are increasing engagement on air pollution from the national funding bodies and also the government initiatives to generate evidence and also to compile the available evidence. And these are the studies which are funded by the government organization that shows air pollution affects health. And in addition to this, we also have number of studies conducted by the research groups across the country, which shows air pollution affects the cardiovascular health, respiratory health, birth effects. So here I would like to present two health effects. One is the impact on the cardiovascular health, that is the heart health. So the results conducted by the GeoHealth group have shown that in Delhi, exposure to PM 2.5 have shown there was significant association found between PM 2.5 levels, blood pressure, and incidence of hypertension, and the effect were more among the individuals with higher waist to hip ratio. But here, obesity was also factored in for the analysis. And the second study is the CHAI study, which found that in Andhra Pradesh, among women, exposure to PM 2.5 lead to increase in blood pressure and hypertension. And we also have enough evidence which shows it affects maternal and child health. So those mother who are exposed to higher air pollution, the children from the mother faces higher risk of mortality under the age of 5. And also they face low birth weight when the level exceeds more than 50 microgram per meter cube. And there was also incidents which have shown that it reduces the lung function, and it also increases the number of hospital emergency visits due to acute respiratory symptoms. And this is not just scientists who are telling that air pollution affects health. In fact, the medical communities have accepted. The Indian Academy of Pediatrician have given a consensus statement that air pollution is an emerging contributor to respiratory allergies. So how this can be used for the policy making? Now turning down to the opportunities. So one approach that I can think of is that incorporating it into the national ambient air quality standards. So the figure depicts the timeline in which the standards was proposed and revised. The last revision was done in the year 2009, and from then we have enough substantial evidence which can be incorporated for the revision. And the second image shows the framework that we suggested, myself and my colleague from when I was previously with Center for Policy Research, we suggested a framework how those available health evidence can be integrated to arrive this national ambient air quality standard. So there should be a committee that should include wide range of experts from air quality scientists, biostatisticians, epidemiologists, clinicians, community medicine experts, and others. So the most critical part is integrating the evidence and arriving at the concentration response function. So for that, firstly, there are like numerous pollutant and numerous health outcome. So the committee should select those pollutant and those health outcome which have robust evidence, and high quality studies should be selected to arrive this safer levels of individual pollutants. So I'm stopping my presentation here. Sorry, I exceeded my time limit.
No, that was very, very interesting. I was trying to take notes as well, not very successfully.
I can share
So
my
I
slides
think we
with you.
can move next. Thank you. That would be very nice. Tanushri Ganguly. Tanushri, really looking forward to what you have to contribute.
Thank you, Amba, first for the amazing intro. Thank you, Bharti, for setting the context, and thank you, Abhinaya, for making us feel old by calling us like a source of inspiration. We're unfortunately not yet been successful enough in solving for India's air pollution crisis. So I'll take a slightly different position. I mean, based on the contours of the debate that Bharti you set up front. So there are three problems essentially that you've identified. One is that air pollution is not just a winter problem, it's a year-long problem. The second piece being that we are overly reliant on meteorology. Therefore, we don't really know whether it's meteorology or whether it's actual mitigation measures, which are translating into air quality improvements for us. And the third piece, of course, that we know that there is evidence around health impacting air pollution, but why is that effectively not getting translated into policy making, or why is that not getting considered in policy making? I'll address the third one first, because of course, Abhinaya has laid down the extensive evidence which already exists in front of us around air pollution and its impacts on health. But I also feel that a lot of this evidence stems from studies which have been conducted in conditions which don't necessarily take into account high pollution environments, like the ones that we see in India, Nepal, Bangladesh, which are essentially countries where the burden of pollution and associated health impact is the highest. What that results in is that we have multiple studies with variations in the kind of estimates that we get of air pollution's impact on life expectancy or mortality or morbidity, which does lend some amount of confusion to the way we are going to internalize these studies into the policy-making process. Therefore, I think the thing that needs to happen, of course, this should in no case stall any kind of action, but the thing that needs to happen is that the evidence pertaining to air pollution and evidence pertaining to impact of air pollution on health should be generated more for high pollution environments, like what we see in Southeast Asian countries and also a little bit of Africa. So that's on the third piece. And the other interesting piece around air pollution and health, we know that the Indian government has for a long time been dismissive about any available evidence around it. But what I thought was really interesting as a development, late last year was that the government has actually now commissioned specific studies looking at impact of air pollution on health. So there is some 20-city study which has been announced. Of course, I don't know the status of that study, but it was indicated that there is a 20-city study that's going to happen, which will look at impact of air pollution on health. Beyond that, also specific studies around impact of crop residue burning, impact of exposure to traffic emissions, and impact of firecracker-related emissions on people in Delhi is what was indicated. This comes from a PIB press release, which came out late December last year. So from sort of this nonchalance and dismissive stance to actually going ahead and saying that, hey, we are going to commission these studies and we are going to generate evidence, I think is a progressive first step. So that's a little bit of my interventions around air pollution and its impact on health. The rest of my interventions, I've tried to categorize it into three broad categories. The first one being what has been good as far as air pollution management in India is concerned. The second piece being what challenges I think still ail air quality management. And the third piece, which I think we could discuss a little more as we go into the Q&A, is about the opportunities that exist within the air pollution space. So what's been good? I think that the fact that we now have a performance-based funding allocation mechanism to incentivize action in cities is a great first start. But there is a caveat to it as to how we are monitoring progress, and I will come to that as I talk through the challenges. The second piece, which I think, again, has been a significant sort of improvement, is encouraging the spirit of competitive federalism through the Swachh Vayu Survekshan. We know that, Bharti will probably be able to share some insights with us on how this has worked out in the case of the Swachh Bharat mission. But within the Swachh Vayu Survekshan, our cities have this additional level of incentive which comes in if they are performing better as far as air quality action is concerned. I think a very clear, tangible victory for the National Clean Air Program has been the significant expansion of India's monitoring infrastructure, albeit with their blind spots in rural and peri-urban parts of the country. But as far as the non-attainment cities are concerned, we see that there has been an increase. When the National Clean Air Program started back in 2019, of course, the concept note came out in 2018, and conversation around the National Clean Air Program had begun back in 2017. We had less than 50 continuous ambient air quality monitoring stations. Again, the data from this was super poor. The data availability was super poor. Now we have 500 of these real-time monitoring stations. So we can see that the monitoring infrastructure has significantly expanded, and this is certainly a tangible victory for the NCAP. Fourth, and for me, honestly, one thing that has happened is the NCAP has created a platform for convergence of different sort of programs which are administered by different government agencies. And this was something that was also highlighted in the concept note that was shared with us. So MORTH is sort of involved. Your MNRE is involved with the biomass mission. MOHUA is involved with the Swachh Bharat mission, as well as the Smart Cities mission and the Amrut. So sort of coming together of these different agencies. And what this has done is, if you just look at the dedicated funding for air quality between 2019, 2020, 25, 26, that's about 19,000 crores. But if you look at convergence of funding through different kinds of initiatives which are aimed at reducing air pollution, it's about 4.5 lakh crores over a period of 5 years. So the amount of money, accumulated fund that comes in, if you look at convergence of actions across different departmental mandates, then there is also a significant amount of resource coming into mitigating air pollution. I'll come to challenges and opportunities. I'll try to sort of speak about both parallelly because I know that I've been droning on for a bit. Biggest challenge, we don't know how to monitor progress of the NCAP. We look at year-on-year improvements in air quality, but does it really do justice? The sort of consistency in monitoring data has changed. We had very limited data. Now we have significant amount of data. So I don't know if we are on the right track as far as monitoring air quality improvements is concerned. The second piece, one is just looking at NCAP and its overall impact on air quality with specific interventions. Mechanical sweepers, smog towers. How are we putting out robust sort of evaluation processes in place to suggest that these measures actually work? One of the things that the NCAP wants to do is improve knowledge sharing around best practices. What really can we propose as best practices if we don't have a robust evaluation protocol for mitigation initiatives in place? There are no best practices without that evidence base in place. And my third and final point is bureaucratic accountability. We know that, of course, doing what China did is very difficult because of the different governance regimes that the countries operate in. But there were incentives built for bureaucrats for their performance towards eliminating air pollution. is there a scope for us to do something like that? Because where does the buck really stop? And how do we incentivize that the buck stops somewhere is very important. And my fourth and final point is, again, going back to something that you mentioned. You said that there is a lot of public momentum building around the issue of air pollution. But in my view, honestly, do we really have enough public momentum? And I'm sure all of you must have seen this article which came out a couple of days back called Riders in the Smog. Very poignant piece of writing around how air pollution impacts gig workers in South Asian countries. But when I read that article, of course, I was filled with a sense of despondence, but I also thought that these people are working through and getting exposed to extremely high levels of pollution, but they don't have a choice. What kind of a picture is that? There is despondence, there is lack of choice. We're not creating, the social conditions for them to exert a choice, even though that they're exposing themselves to high levels of pollution. So where is public demand going to come from? Because demand would be making a choice, but you can't really make it. So yeah, on a little bit of a provocative note, I'll end my sort of introductory remarks there. And back at you, Bharti.
Well, thanks, Tanushree. I'm, so happy to hear some of what you said. These are the big truisms, and this is our context. And in fact, Chintan also had brought out something called Unfair, where we looked at our workers with outdoor work and the impact, along with Dr. Randeep Guleria and Tejas Menon Suri at that time at AIMS, really the impact. And I think, the point is exactly that. There's no real solution for them because they have to survive and have a livelihood except to clean the air itself. The big solution is the solution. But without much ado, over to Sunil Daya. Sunil, really looking forward to all that you'll say. You always surprise.
Thank you. Thanks, Bharti, and thanks, Abhina and Tanushree, for setting that beautiful context. And I also feel like I really am very happy that for the first time, I think in so many years, we have seen you guys and 3 panelists out of 4 being the female panelists. That's something which has definitely changed. That's a really good change which was needed and which is coming, and will definitely might also change the way we have been tackling the air pollution issues, because while we have been speaking about air pollution for a long time, the real actions in terms of effective change are missing, and part of it has to do maybe with that we are merely just speaking and translating very little into actions. And that's why to have this different diverse groups across genders, age groups, technical skills, as well as reach in terms of who are we speaking to, it's something which has broadened. That's like, I'll start on that positive note that 5 years back, even though there were few civil society organizations talking about it, we didn't have enough researchers, we didn't have enough technical skilled people, we didn't have even policymakers coming to these dialogues, and that's what has changed. That's a positive change. Slight kind of building on what Abhina and Tanushree were saying, a slight intervention there. Even though we have National Clean Air Program, one thing which we all are acknowledging today, even though we see lots of headlines in the newspapers as well as government claiming that, this is the cleanest year on record, this is the cleanest month on record, or whatever, we know that NCAP hasn't been very successful in terms of reducing air pollution. While we say that, we are not saying that there hasn't been anything done. We see some actions such as introduction of Bharat 6, which we can attribute to National Clean Air Program, but it's a program which was planned way before NCAP was even conceptualized. And that's where I think that synergy of different government departments coming together and being put together in one report or a policy framework document sort of thing is, I believe, what National Clean Air Program did. In terms of actions to be taken, it's mostly all those different departments under whose purview those actions fall in. So NCAP is a mere compilation of lots of plans existing before NCAP came into force. But along with that, what NCAP did was it definitely emphasized the need for more monitoring data. It emphasized the need for certain scientific studies to be conducted. And it emphasized on public availability of that information and data so that there is enhanced accountability which can improve the air quality. And on all of those fronts, I'll first give you three examples on these fronts. The first one was on the data disclosure. Tanusri very well mentioned that CAQM numbers or real-time air quality monitoring has increased from around 50 in 2017 to 540 right now, which is a really good improvement. But when we just look at the numbers, maybe the picture we are getting is not the entire true picture. What we have also seen that while these number of monitoring stations are increasing, some of these are put in locations where they shouldn't be put. Some of the monitoring stations aren't even, or a lot of monitoring stations haven't even been calibrated, and they might not be even providing the right kind of data. Like we have also started seeing news where we see whenever any city makes to the topmost polluted list, we start seeing water sprinkling around the monitoring station. So there is a lot of data manipulation also which has started happening, and there are evidences of that being visibly done around us. So is data really credible? Is increasing number of monitoring stations is the right yardstick to measure whether the kind of data which we have is useful or not? Then coming to whether we have been really impactful in terms of reducing air pollution levels or not. When National Clean Air Program started, we had in the first draft version about 94 cities, which were initially part of it. Then because of public pressure, there were 8 more cities added. And when the NCAP came out, there were about 102 cities in the first version. Those have increased to 132. And if we look at the January data or even February data, which we have been compiling, we see there are about 110 cities which were beyond the national ambient air quality standard for February, which means that air quality is really bad across the country. Only 30 of them were NCAP cities, and 37 or 38, about 57 cities were beyond NCAP cities. So are we paying enough attention to cities which are not part of this clean air program or not, and tracking their progress? Maybe we are not, and that's why we need to look beyond the existing list of NCAP cities. Obviously, one criteria which the CPCB has put in place is that a city will be classified as non-attainment only if it has at least 3 years of consistent data beyond the national ambient air quality standard. But the sad reality is that few cities, like 20 or 30 cities, have now expanded to more than 200 cities, and these 250 odd cities won't have 3 years of data. So why do we need to wait for 3 years for a city which in all the months, for all the years since the monitoring station is operating, is been showing high values? Why shouldn't we include that in non-attainment? Why should people suffer there? So I feel that even on tracking, how are we including the cities under NCAP, and which cities are making progress, is something which definitely needs to change. Now, coming back to why are we talking about this? Why we still have air pollution issues at such high levels, even though we have National Clean Air Program, we have Grid Response Action Plan, not just for Delhi NCR. I think this is a plan which has to be implemented in all non-attainment cities. So every non-attainment city has to have a Grid Response Action Plan communicated and implemented whenever the pollution level reach in the break-even point of that particular category. But we very rarely see it being even communicated to the media or general public beyond the Delhi NCR cities. For Delhi NCR, we at least have Commission on Air Quality Management, which is a replacement of EPCA, which was classified to be ineffective in curbing pollution levels after being in existence for a really long time. And CAQM has all the powers of cutting down on pollution sources, shutting down industries, shutting down activities, and it has immense power to kind of reduce pollution level, because it also has representation from all different departments, for example, Ministry of Road and Transport, MOVA, and even the state government representatives. So we have that kind of mechanism, but even despite that, we still see air being polluted in Delhi and all Delhi NCR districts as well as across the country. The issue is also that the larger narrative these days which we hear is very controlled, and when any government agency or a government says that air quality is improving, even when like for example Bharti was talking about that this is the cleanest February on record till now, but you'll be surprised that average PM 2.5 levels for February for Delhi were 103 microgram, which are nearly 2 times the Indian standards and more than or around 7 times the WHO standards. And then we have to go back to the point which Abhinav was making, that the dose response curve is a very sigmoidal kind of curve where at very low concentrations of less than 5 microgram or 10 micrograms, there are little impacts. But as it crosses that threshold of 5 to 10 microgram, the incremental health impacts are very, very high, and then they plateau at a concentration of 70, 80, or 100 microgram. It doesn't make much difference if you reduce concentration from 150 to 120, but it makes huge difference if you reduce it from 25 to 10 or 15. And that's why I think what we need to see is whenever we are talking about reduction in pollution level, we need to see in absolute terms how much is that reduction and how does that translate into health impacts. Now, I'll not just going to talk about what's going wrong, but there are lots of, as Tanushree was mentioning, lots of things which are going good, but how do we improve them to be better? So I'll try to summarize that in one together. So we know that there is continuous emission monitoring being done by the industries. So the government knows where these industries are. They know what's been emitted. There is all this data on the fossil petroleum product consumption, number of vehicles. We have the meteorological data, and based on those kind of data sets, that factual data, we have, or the government bodies themselves have also developed certain tools such as decision support system, which tells that this particular sector or this geography is contributing to so much pollution. We know that this is where the wind is going to come from in next 3 days. We also have real-time source of possible studies, at least for Delhi, which are available. But with those tools existing, are we using them effectively? Have we even directed certain industries based on the forecasting of these pollution levels or based on these tools to regulate their pollution? Maybe not. And that circles back when we have the data, when we have the tools, why are we not able to reduce pollution? And the answer lies in the nexus of the politics and administrative governance of air pollution in this region. And that's where you might have even seen a body like CAQM, which has immense power and had a really decent, robust version of graded response action plan when it was formed, which also included certain actions on industries and power plants. They revised the graded response action plan last year. I don't know the particular or primary reason behind it, but in the revised graph, you won't find a mention of a coal-based power plant. You won't find a mention of the industry. And we know for sure that coal-based power plants have been the ones which have been floating the environmental norms for last 10 years, and every time they don't comply to a deadline, they get an extension. So what made a body like CAQM or the government drop that such a big polluter from that list? There is an explanation given for the industrial sector saying that most of the industries in Delhi NCR have converted to PNG, but we are also seeing clusters like Sonipat, where there are new and new industries coming up, and there is more solid fuel consumption in those industries. So why aren't those industries part of CAQM? So that says that there is a lot going behind the doors or behind the papers or the policies which comes in, which is definitely influenced by the lobby power of these polluting sectors, as well as the dynamics of different political parties governing different states and not really aligning with each other, because they feel that it's not an election issue. Nobody is going to vote on high air pollution levels or them cleaning the air, but what it does give them is an opportunity or a chance to blame each other, saying that you didn't do that and you didn't do that, and that's something which we keep seeing every time, and that takes us back to the farmers. Everybody, like most of the people who know about air pollution, you ask them what's causing pollution in Delhi, and everybody will stand up and shout that it's the farmers, it's the stubble burning, because that's what they read the most, that's what they see the most in news channels, that's what most of the politicians talk about. But behind those farmers, all these bigger industrial players, be it power sector or any other industrial cluster, or even the administrators who are given the responsibility to reduce air pollution, they all are hiding their inaction, and they have never allowed somebody or general public researchers and civil society to kind of talk about the real issues. So now what I'm saying is that we do have data, we do have tools, we have the governance mechanism structures, we have given the powers to those structures. It's just that we have not been able to implement that on ground. If we club the data science and the governance for an efficient functioning, we'll be able to reduce air pollution levels. I'll just give you one example, very short example. That if the CAQM, which is a body which has representation from all the state governments and polluting sectors, they have access to the real-time source of enforcement, they have access to decision support system, they have access to CMS data, they'll be able to know who's causing pollution in what location, and they also have access to meteorological data, which will tell them that an air parcel which started in Punjab in 3 days will be reaching Delhi. And it's not just about Delhi, any other geography. And if they can only regulate industries in that particular direction, that will be more efficient functioning of the governance structure, rather than ordering all the districts in Delhi and start to restrict their operation, because you cannot stop the industrial activity or economic development in a region. Sadly, our economic development is still linked to high consumption of fossil fuels. So our directions have to be directed, and they can be directed because we have data. It's just that those tough decisions needs to be taken and implemented more efficiently.
Great.
Thanks. I'll stop there and maybe.
Thank you, Sunil. Gosh, that was like, it was such a landscape level, an insightful, intervention. So I'm going to take the liberty of asking questions just before, as people gather their own, especially CSDR colleagues. And I would really request like short and succinct responses, just because we do want to hear more and more people, ask things. So I'm going to jump straight to Tanushri, actually, just to disrupt the order a little. Tanushri, very briefly, looking back at all the experience of all these previous years, starting from, say, the 2016 and so on, and then looking at the new cities such as Mumbai that are coming under the shadow, or at least acknowledging that they're under the shadow of the crisis, what would you personally advise should be done now with all the wisdom of hindsight? How would you approach this? Would you do it differently for Maharashtra and Mumbai? What would you do?
I would be more transparent with the data. I would ensure more public participation in decision making. And I would definitely check the construction sector. Why the construction sector? Because it's something that can be fixed. We now have a remote monitoring and enforcement systems in place. So I honestly feel that construction is one sector which is certainly solvable. And as far as Mumbai is concerned, it's significantly contributed by construction dust. So I think real estate developers have this opportunity to get their names registered in history. They need to sort of fix their act and ensure that at least we're able to fix the construction sector. Transparency in data is important because it at least begins a dialogue, because people are then able to internalize information. If there is a dialogue, there will be a public pressure. So being transparent about existing data and also creating avenues for hyperlocal data generation. We've not had luck with it. We had the opportunity where we could leverage civil society efforts and community-based monitoring exercises to plug data gaps as well as hyperlocal sort of regions are concerned, but we missed that opportunity. But for Maharashtra, we have that opportunity. Get people involved, let them monitor their neighborhoods, let them report on grievance redressal apps what's happening. And at least we can then fix our urban landscape. I understand that as a community, we're strongly pushing for regional initiatives, airshed level management, but I still feel that 50% of the problem is with cities, with communities, with neighborhoods, and with the right and strategic information, we can mobilize people to act towards it. So transparency of existing data, creating opportunities for hyperlocal data generation, and sort of using that as an opportunity for people to get involved in decision making and fix the construction sector.
Fabulous. So Dr. Shekhar, coming to you, have you found that GRAP in any way has led to, or is there evidence to actually positive outcomes in human health?
Yeah, so we have GRAP as an emergency response plan, and it comes into picture when the pollution peaks very high. As I mentioned before, the efforts to mitigate pollution should be appreciated. But however, like we don't have any scientific studies which have shown that GRAP has reduced the pollution, or it has improved the health. It has shown some health benefits. So as in every other case, there is still a room for improvement in case of GRAP, such as efforts such as deployment of anti-smoke guns and smoke towers are unlikely to be effective, and the focus must remain on need to reduce emission at the source. Like a lot of us have been speaking about it a lot, and I think we have discussed a lot in recent years about this reduction in source. But one measure that bothers me under GRAP is that I would like to emphasize today is due to its critical importance is the closure of schools. So my colleague and Arunesh have joined the webinar. We have written an article about it, like why shutting down school actually don't reduce the exposure to the school children. So while the rationale behind this decision is to protect the children from harm, but it lacks the scientific support that it reduces the exposure. And it also disrupts the learning, and it affects those children who are from the disadvantaged background, who don't have access to air purifier or good ventilated homes and stuff. So closing schools under GRAP is a poor trade-off between the marginal health benefits, and it offers a significant educational setback to the children. So so to reduce the exposure, a region-wide effect should be undertaken. And rather than having the smoke towers, we could equip the classrooms with air purifiers. In fact, in US now routinely, which is experiencing poor air quality due to wildfires, this measure has been increasingly adopted in the US, that is installing the air purifiers in the classroom and making it more functional. And also, with respect to the effectiveness of GRAP, and one more point that I wanted to highlight here, and I highlight in multiple places, is that the the pollution effort should go beyond the dust mitigation activities, because in India we have increasing number of studies which is showing that even the ozone and nitrogen dioxide is associated with increasing health burden in the country. So there should be shift from dust mitigation activities to regulating all the most highly important pollutant. So these are some points that I wanted to share for achieving some health benefits. Yeah.
Thank you so much. Coming to you, Sunil. And by the way, just our colleagues and partners, CSDR, if there are questions, I'm happy to interrupt. And we can always ask Sunil his question later if there are colleagues who've asked questions. I don't see that. So let me know if there are.
I think we can take up the questions at a later stage.
Sure. So I'll just move to Sunil. So Sunil, you've often talked, previously about coal-based thermal power plants. And what I find really interesting is that a lot of that discourse is around Delhi. We talk about as if Delhi is the center of the universe and everyone lives in Delhi. And so, we've closed down this and we've closed down that. But essentially, historically, what we've done since the mid-2000s is really taken all our industries and put it elsewhere and used resources from other places, right? And they have their own ramifications. So in many ways, I'm very curious to understand, before I ask you the question, there are all these kind of, you yourself mentioned some, but there are all these new kinds of industrial areas, which are areas which were always industrial, but now they've become quite concentrated. And whether we're looking, even for that matter, at Panipat, which used to be 20 years ago, just a massively, brilliantly intense cloth and woolens manufacturing sector, and now it's got so much more. There are things like that. Would you have a comment both on what we can do around air pollution and coal-based thermal plants? And also, would you care to comment about the status of air in these industrial areas of which we know very little?
Yeah, thanks, Bharti, for bringing up that question. So, basically, we only because of this reason that the air pollution discussion is mostly concentrated around Delhi NCR, and everybody speaks about Delhi NCR. Because we've been working on this issue for a long time, we are trying to put some efforts to initiate these conversations in other regions, and the first step to that is a little bit transparency in terms of making the data accessible and understandable by people. And what we do right now is that we put monthly snapshots of air pollution levels across different cities in India. And you are right. We have found that yes, Delhi is one of the most polluted cities in India, but along with that, many cities in Delhi and Sonipat, I gave as an example. We also see Bhiwadi, which is another industrial town, which is coming up as one of the most polluted cities. Greater Noida, Faridabad, Ghaziabad, all these cities are as polluted as Delhi. But we also see cities like Bhagalpur in Bihar, which is not part of NCAP list, which is not known to anybody in terms of polluted cities, that had equally bad air as Delhi. And leave that aside, even cities in northeast, Bernihat, which is a town on the border of Meghalaya and Assam, and Meghalaya is seen as the cleanest geography or a state in our country. That city was the third most polluted city in January. That says that a lot of these cities, which earlier never used to be polluted, are much more polluted now, but we have not been paying attention to it. Coming back to the question on thermal power plants, it's very sad that power generation, which was it's one of the most polluting sector, which is known globally. We know that a lot of countries which acted on thermal power generation, reducing their emissions, have gained significant air quality improvements. Tanushree mentioned China cannot be quoted as an example because of the different governance regimes, but they have at least seen drastic improvement by controlling that sector. And that's why maybe we cannot replicate what they did in terms of timelines, but we can definitely learn from it and do it. And after learning from it, since 2015, we have been trying to reduce pollution from thermal power generation sector, and it's very sad that only less than 5% of capacity has regulated those emissions, even after 10 years of regulations being enforced. And it's not just Delhi NCR, it's plants across the country. Now, if that's the status of a sector such a thermal power sector, which is so much talked about, so much well known and more systematic, other industrial sectors such as steel, aluminium, brick kilns, and many others are a very different story. Nobody knows about that. There is no data out. What would they be doing? So it all boils down to that Delhi is just an example, but there are so many other cities which are breathing equally bad air, or at least hazardous air, which is putting millions of people at the risk of health hazard from air pollution. We have seen Maharashtra being an industrial state. A lot of cities from there also started observing a lot of high pollution levels. And partially it's the construction sector, but it's also a fact that we are repeating the same mistake which we did in Delhi NCR, that we wanted to clean Delhi and only concentrated on Delhi for the last 20 years and allowed these industries to come up in the peripheral towns and cities. And that's what's happening with Mumbai as well. We only talk about Mumbai, but it's the satellite towns around Mumbai where a lot of this construction and even industrial activities are increasing. And that's why we need to take that airshed approach to reduce air pollution levels.
Thank you, Sunil. I'm going to move again to Dr. Shekhar, and I'll just pick up Bhagalpur and Benihart, and really turn to you and ask you, when these extremely polluted places that we didn't that aren't part of the NCAP, they're not receiving funds and are unlikely to in the very near future. From a health perspective, what do you think are the things that need to be put in place and can be from existing systems or built out from existing systems, at least in a very foundational sense of it? Are there some things you would like to see done?
Yeah, so we have this program conduct by the Ministry of Health, that is the National Program on Climate Change and Human Health, which acts at the district level. So I think that program would be a better opportunity because they addresses a lot of issues like air pollution, heat wave, and in fact they built healthcare infrastructure for the resilience. So the hospitals in those regions can be built, the infrastructure can be improved to have this to address the impacts from air pollution and heat waves and stuff. And even under the same program, we have something called the surveillance system, which regularly monitor the which plans to regularly monitor the air pollution related illness for the early warning system. So those really vulnerable cities or districts can be brought into the surveillance, and the local level data on the health data can be incorporated for the early warning thing. And so and they also have something called as this integrated disease surveillance platform. So I don't know how it works. It's a recently emerging one. So working on that, maybe, like, I don't know how it works under NCAP, but there is a separate program under Ministry of Health, like, which don't speak with each other, that like the NCAP don't address the health. And we have this national program on climate change and heat with the Ministry of Health. So so at the district level, such things, the collection of health data, or like making the healthcare system better for those districts can help.
I have a follow-on question for you. We talk of surveillance, but that's like a really vague kind of thing. And I often feel that surveillance isn't adequate in many ways. Firstly, what they're telling us about, and secondly, who's hearing them. And thirdly, what action can you possibly take when even if you were to receive that message accurately? So I'm just curious to understand from you, what kind of surveillance do we really need for impact, and how is it ideally needs to be delivered if we're really looking at air pollution? And is surveillance at all, or I would say warning system, does that even make sense? I mean, what do you do? So I'm always a little conflicted about these things, and I'd really welcome your comments and insights.
So so you would be the better person to think about it because you work at the ground level. Like, I see from the big picture level.
That's why we need you.
Yeah. So so from my standpoint, why the surveillance is important is that we can serve, like, they can have surveillance data on number of hospital visits or health related data, like health, even during the winter season and summer, even during the summer in US, because in the summer there is increase in level of ozone, and so ozone is also a respiratory pollutant which causes similar effects to the particulate matter and stuff. So when the temperature is higher, at the higher ozone days, they tell the public not to go out when the temperature is higher, which might have higher exposure to ozone. So something of that sort, like informing the public, like even AQI does the same, but by incorporating the local data, telling what can be done, like the death increases, so the elderly people can stay inside the home, something of that sort. Like at least building the health data through the surveillance system would be helpful for the researchers to understand what is the trend of what is happening.
No,
That is what
absolutely.
yeah.
Though, is there any place in the whole country that you think is doing a good job with communicating this? Any city, any district, anything?
I really don't have any idea. Like I haven't come across any such cities which even the surveillance data is not out for the public. It is
Yeah.
for the officials. Like we don't have access. So it comes with we have to go, have the login ID password to enter and see the surveillance. So I've never seen the surveillance data. So it exists, but yeah, I don't know which city or something is good performing in that.
That's really really fascinating, because there is the crisis, right? And on the other hand, there is the data, but somehow they don't come into the public space,
Yeah.
right? I want to go back to Tanushri. Tanushri, why do you think you've worked on a lot of issues, but I was very struck from a very old conversation we had. Again, it was an online conversation on biomass for heating and biomass for cooking. And I know you were uniquely engaged with this issue. And I really want to understand, that landscape, because it impacts women in such an unfair way. And it's also something that we've tried through the Ujjwala, India has tried. So what are the things that have gone well and what haven't gone well? What else should we be doing? Because it looks like it's this whole crisis that we haven't addressed till now on this panel.
Right. No, so thanks, Bharti, for this question. I'll come to this, but I also wanted to respond to the previous question that you had for Abhinya.
Yeah.
I think it was a very philosophical question. What are we going to do with all the data that we are generating? What's the point of surveillance if the data is not being put into use? But I think we need to think a little more creatively about this. I mean, if you this is just, I was just thinking this through as Abhinaya was making her interventions. You remember during COVID, we would sort of, the government would actually provide data on how the number of cases are increasing every day.
Yeah, yeah.
So, can't we do something like that in terms of hospital visits, at least during the high pollution season? The other piece of surveillance, which I think is super critical, is out-of-pocket expenditure. I can tell you from a personal experience that I'm 100% spending more on medical aid during winter season because of the number of times that I'm falling sick. I think unless and until we communicate to people that you're not just, this is not just a brunt on your health, which you will see 20 years down the line, but this is burning a hole in your pockets, we will not see the kind of public demand for clean air that we envision. And that's why I think sort of moving away from the narrative that says that air pollution is a public health issue, we should actually say that investing in public health is actually an investment in social welfare, going to the point that Abhinaya was making about school children, as well as an investment in economic development, because you have to shut down industries because pollution levels are so high. So I think that instead of being extremely sort of narrow in our outlook about investing in air pollution as a public health or environmental concern, sort of tying it with more the social welfare and economic development argument would be a much better messaging. And as far as surveillance is concerned, I would love to see how out-of-pocket expenditure is going up, because that also then reinforces that it's actually a very unjust conversation. Air pollution is no longer a leveler. It's basically actually increasing, like you were saying, it's just unfair. Right. And now on to your question on sort of impact of biomass, two issues there. One is Ujjwala, related to cooking emissions. And I think the conversation that we had was with respect to use of biomass for space heating requirements, which does show up as an issue of concern, particularly during winter months. One, because it's very difficult to track it. We can actually identify specific spots within the city where we do see, the homeless and the slum dwellers basically using biomass for their space heating needs, but we don't really know to what extent this is used. And I have from, again, personal experience, as I'm taking a walk on the streets during Delhi during the winter months, I do see, a lot of people collecting firewood, which is all essentially ending up getting burnt during winter months for space heating requirements. Now, there is no alternative to it. I mean, we, in my previous role, we'd put out a study wherein we had looked at occupancy of shelters in Delhi. There are shelters in Delhi, but the way they're equipped, the occupancy is not as high. People need comfort from winters. And I mean, what they resort to is using biomass for their heating requirements, which is a significant share of local emissions during winter months. So like, if you look at the winter season, there is just the post-monsoon season, which is essentially dominated by emissions from stubble burning. Then we come to, the Diwali wala phase, wherein we see the whole chatter around firecrackers and sort of the weaning phase of the crop residue burning season. And then we go into the bitter seasons. So December, January is as bad as October, November is. And this December, January, it's probably something local because the stubble burning issue is not impacting as much, which is where the use of biomass becomes an issue of concern, and primarily due to space heating. On Ujjwala in particular, I know a few years back, there was some kind of an assessment made, I think, by the Ministry of Health and Family Welfare around the impacts of Ujjwala on ambient particulate pollution levels, as well as the subsequent impacts on health. I don't know if that study ever came out in the public, but there was a study that was actually initiated by the Ministry of Health and Family Welfare. But this comes back to the point that I was making at the beginning of my introductory remarks. We don't have a system in place for robust evaluation of any policy measures that we are making. And that's the culture that we need to enforce in the country at this point in time. Whether it is a program like Ujjwala, which we definitely know has resulted in increased number of LPG connections in the country, but we don't know if that increase is also commensurate with sustained usage of LPG in the country. So we need a robust monitoring and evaluation protocol for that. The same can be said for the city action plans. We have city action plans, but have they been translated? The same can be said about DSS. Delhi is in that blessed spot of having a DSS, a real-time source apportionment study, about 40 monitoring stations, but we still saw the worst pollution season in winter 2023. So we need to have in place a robust monitoring and evaluation system, which can see how policies are translating into on-ground action and so on, air quality improvements. So that's a long and winding answer to your very simple question.
No, it was simple because I just didn't have the depth and the insights that you have, Tanushree. So I'm so grateful for those. Sunil, is there something you want to say briefly before we move to other questions? Are there other questions, Amba?
Yes, we do have a couple of questions in the Q&A box.
So should we,
I-
Sunil, I thought maybe we could, if Sunil
Just-
has something, because
Yeah,
I think he
yeah.
looks like he wants to respond to everybody else. I mean, he has that look, and I do want to give him that chance.
No, so just adding on to what Tanushree was saying, that we don't have robust monitoring mechanisms. In an absence of that, we end up making wrong decisions. The Swachh Vayu Survekshan, which Tanushree was mentioning about, and mentioning that we look at the air quality improvements. Yes, we do look at the air quality improvements, and in the days of data manipulation and wrong data and lack of calibration facilities and other things, I think that's not the right parameter. But what we also need to look at is in that entire survection, it gets only 5% weightage. So 95% of the weightage in that ranking is given to measures whether you have installed a smoke tower or put up water sprinkling guns or something of that sort. How many mechanical sweepers do you have? How much money have you spent? Doesn't matter on what. So if we use those kind of indicators, they might lead to wrong conclusions and might then lead to wrong usage of the resources and money you have. What we might have to do is we need to look at emission load reduction at the source, which Abhinav was talking about, because that's the main bullet to reduce air pollution levels. And that's why we need to maybe if, at this point we don't have enough data to say that this is the emission in a particular city and this is how it's reducing or whatever, but we at least have consumption level data on different fuels, different fossil fuels, number of cars being include those fossil fuel consumption data, as well as increasing public transportation or increasing number of privatized usage of vehicles and all those things in the indicators, and say that this has to come to a stop. It can increase, maybe we can't stop it right now. It can increase for next 2 years with better efficient controls, but after that, that needs to change its trajectory and direction, and that's the only way we are going to reduce emission load. We still don't have any emission load based approach in our measurements or indicators, and that's, I think, which I wanted to add, that we should think about right now. Yeah.
Well, thanks, Sunil. Amba,
Now
question.
now we'll take up questions that we've received in the Q&A box. Mr. Shrikant Gupta asks, can you please comment on the non-existent role of CAQM in tackling air pollution in NCR? This is the
I
first.
think Sunil would like to. You've been tracking it, your work and makes you
No,
look at it. Yes, Sunil.
I even mentioned it in my opening remarks that I feel very disappointed with this new commission having immense power to be able to control pollution, and also having the history of seeing EPCA working or not working and learning from it, and then it somehow really only resorting to communicating whether GRAP should be implemented or not. Where is the question of GRAP being implemented or not? Like, it's a program which, if a pollution levels cross a certain level, that is automatically supposed to come into force or whatever. So what your job at CAQM is to ensure that those actions which are stipulated under those different categories are taken. Obviously, we have seen a lot of so-called notices, closure notices, and all those things. But what we have also seen that I mentioned that power sector and the industries have been dropped from the action list under graded response section 1, and that's where I feel GRAP has much more powers, much more capacity to control and regulate air pollution in the larger space, and it hasn't been able to do so. I also feel that it hasn't even been able to use the existing science and the tools which exist with them. And if all that is used, if all those tools and data is used with the powers which CAQM has, it can definitely do much better than what it's been doing. That doesn't mean that CAQM hasn't done anything. There have been definitely, if an industry is getting 10 notices in a year saying that your pollution levels are high, that industry will be careful next time going above the prescribed levels or whatever. So it has definitely increased a little bit awareness, a little bit of fear in few polluting sectors, but it hasn't been able to effectively reduce air pollution levels, because one, it just reacts to pollution levels. It app is not supposed to be a reactionary protocol. We heard so many times that the pollution levels had breached 500 AQI mark, and after that, a certain stage came into action, particularly during the last winter. And that's where I think there is huge scope of improvement under GRAP and under CAQM. And I also feel that there should be some kind of accountability fixed. Tanushree was mentioning there should be incentives for people to do better in our administrative divisions. And that comes from Chinese example. Chinese example also tells us that if they don't do well on their job, there should also be penalization of those authorities and those departments. And that penalization and incentivization of the officials and administrative departments is missing, and that makes them believe that nobody can really change anything about their job, or how their promotion is due and how will it happen or not happen. So if we link some of those incentives and penalizations with the functioning of bodies like CAQM, maybe we will have better implementation of the measures on the ground. Why should we give somebody just the powers and not that fear of being penalized?
So there's another question from an anonymous attendee. They ask that many authorities claim that the NCAP targets have been met by ULBs, but is it the actual case, or is it related to the modification of monitoring stations or monitoring mechanisms?
So who would answer that? Tanushri?
I can answer that, but I think honestly Sunil should come in on this. But again, I mean, I will go back to the first point that I made. The way NCAP is structured and the way we are evaluating progress towards NCAP. So essentially, the NCAP says that there has to be an improvement by 20 to 30% in non-attainment cities with respect to 2017 as the base year. And now they've increased it to 40% by 2026, again with respect to 2017 as the base year. But if you're looking at just 1 year's comparison with respect to 2017, I mean, you can probably see a difference. But now, if you track the long-term trend of pollution levels, I don't think there has been an improvement. Now, again, if you look at the definition of non-attainment cities in itself, for 5 consecutive years, you have to meet the ambient air quality standard to not be designated as a non-attainment city. And that has not been the case with any city. So the fundamental way in which we are monitoring progress, that just look at a base year, see whether or not you've improved with respect to that base year, does not mean that you've met the target. Unless and until you're showing a progressive decline in air pollution over 5 or 6 years, I don't think any of the cities has met its target. And, you know, like the gentleman who's raised this question has rightly pointed out, there are targeted activities that are happening around monitoring stations, like sprinkling of water as such. And then somewhere stations are being, you know, relocated. The actual calculation that happens, from what I understand, takes into account both data from manual monitoring stations and continuous monitoring stations, but we don't have access to any of the data from manual monitoring stations. So with so many uncertainties within the system, it's very difficult to say whether NCAP is actually translated into air quality improvements. What I will definitely say is there has been minor improvements in cities, but significant improvements, not really.
Great. Sunil, you want to jump in?
No, I think Tanusri covered it well. Like, there is no guaranteed proof that they, apart from Bharat 6, which I acknowledge, and LPG penetration, these are 2 things which has happened. And this is like the thing about this thing is that Bharat 6 for LPG penetration is not for the non-attainment cities. It's for all the cities, irrespective of whether they are attainment or non-attainment. So apart from these 2, there doesn't seem to be any other measure reducing emission load at the source. And in absence of that, any city saying that they have reduced pollution levels by 70% will definitely raise some eyebrows and some questions in terms of whether the data which has been quoted for this is right or wrong. I'll again give an example of Varanasi, which seems to be a city which reduced pollution level by 60 to 70% in last few years. But if Kanpur, Greater Noida, Ghaziabad, or any other city, Patna, Begusarai, any of these cities in IGP haven't been able to reduce pollution levels, and on the contrary are increasing, how come this one city in the polluted river of IGP be so clean? That definitely raises some questions on the data quality, and should be a bit more investigated before or by people who are tracking air quality trends.
Great. So,
Yeah, we have another interesting question. City level action plans have been prepared and notified under various legislative frameworks, but fail to make any measurable impact. Please share your opinion on the associated hurdles. I think each one of you should take this question up and give your perspective.
Yeah, if I can go first. Yeah, so when it comes to action plan, we have this at the national level, we have this national clean air program, and at state, we have the state action plans, and we have city action plans, and we have this hotspot based action plans. But however, like I was looking some action plans from Tamil Nadu, and I was seeing it has 4 non-attainment cities or something, and the action plans mentioned, the plan mentioned in all the cities were more or less the same. In fact, in the industrial town of Tamil Nadu, like there was no mention to address the industrial pollution there. So I don't know on what, so if it is based on the source apportionment study, if it is made, then it would have included the industries also. And also, we also found there is no connection between the state action plan, city action plan, and like I don't know, I don't have access. I didn't find hotspot action plans, but it exists. But there is no connection between the state action plan and the city action plan. It was not nested. So this is what something I wanted to flag.
Amba, do you think there's another question?
No, I was wondering if each panelist has a take on this question on legislative.
Yeah, and I might add to the question just to make it more complex is like, what's missing? So who wants to go first? Dr. Shekhar has answered, so it has to be one of you.
Anusri, would you?
No,
like to go
please,
first?
please, Sunil, go for it.
Please go for it, yeah.
So we have the city clean air action plans, and I think this was the first component of NCAP which came into existence while expanding the monitoring network after NCAP was notified in 2019. Like by 2019 end, we had cities preparing their city clean air action plans. National Clean Air Action Plan says that it's any action plan made at the city level, state level, or national level has to be a dynamic plan, and it has to be updated with more information coming in. When the city action plans came in, obviously they didn't have any information on what the pollution sources are, what the source of enforcement is, which source is contributing how much, and all those things. So they just earmarked different actions which were based on earlier letters or actions taken or sent by CPCB to different states and cities. We are right now in the 5th year of NCAP being in force. Until now, many of these city action plans have not been updated. A lot of those source apportionment study, which was supposed to inform which sources are contributing higher or lower to the city's pollution, were supposed to be completed by 2020. According to the data available, it seems that more than 40 cities as of now, less than 10 are available in public domain. And even when we look at these action plans or this source apportionment study, they seem to be very, lot of them, apart from few which we saw for Maharashtra, no city had a emission load reduction plan mentioned in those city action plans. So in absence of that, what happens is that city action plan will say, will put mechanical sweepers, will install monitoring stations, will plant trees, will sprinkle water, and any XYZ actions which are taken on visible pollution sources. And that's what, if you look at most of this money which came through NCAF funding or even from 15th Finance Commission funding, it's spent mostly on controlling the visible dust, and that has led to most of people in Delhi NCR would resonate with this visual of a truck going in the morning when you go to office, which has some broom kind of structure. Most of the times that's not even revolving or that's not operating, but the truck is moving very slowly, slowing down the traffic, creating a bottleneck on the road. And then you'll see behind it, there is a water sprinkler going in another truck, which is sprinkling water on the trees on the divider or the roadside, which ultimately, I think at a concept level, it was good when it came up because, but it started happening the other way around. You sprinkle water first and then suck the dust so that it doesn't get resuspended. But it's done the other way around. It tries to suck first and then put the water. But what I'm trying to say is that in absence of our city action plans being informed by the science, being informed by the new knowledge which has been added in the last 5 years, we still seem to be spending a lot of money on wasteful actions. And as Abhinav was mentioning that all these states were also asked to make state action plans. There were supposed to be AirSet level action plans and carrying capacity studies being done and all those things. So when I mentioned initially that NCAP is a compilation of a lot of different plans, but NCAP itself wanted to do a lot of studies or asked cities to do a lot of studies, and sadly none of those components which were unique or new, which were proposed by National Clean Air Program, have been completed, or even if they have completed, they have not been included in guiding our policy and implementation of measures to reduce air pollution levels. And that's why I think we don't see the kind of improvements in cities. Obviously, there are cities which are showing drastic improvements, but there are questions on the data quality there. And the other thing which I also mentioned earlier, a lot of facts, that doesn't mean that nothing has been done to reduce pollution levels. There have been actions. We see a significant drop in the fire incidences during the stubble burning period. So that's definitely something where the government has done slightly better than what they did 5 years back, but there is huge scope to do more. Bharat 6 implementation, which has definitely reduced the emission load from the transportation sector, but if we don't control the petroleum product consumption or increasing number of vehicles, those gains which we achieved in the transport section will be negated in next 2 years, because the sheer number of vehicles will increase, and that will be negated. LPG, as Tanushree mentioned, that we have a lot of connections which has been given in the last few years, but whether those are being continued and whether these poorer sections are using that or not. So all these kind of improvements, even if something has been made, are not restricted to NCAP or NCAP cities. These are plans and policies which were already in place, were supposed to be done, and giving credit to NCAP for improving that seems a bit unfair. But what I feel is city action plans in existing forms without indicators on consumption, on emission loads, on having targets and even reduction caps will be very inefficient. We'll still do something to improve air quality, but those actions will be so dispersed, so inefficient, that we'll end up spending a lot of time and money on things which shouldn't be prioritized the way they are right now.
Thank you, Sunil, for your remarks. And I would now request Tanushree if she wants to add in.
Yeah, actually, just 2 quick points. I think Sunil's covered this really well. I think one thing that I would love to see is the government coming up with an evaluation of the NCAP. So it's been 5 years. We've not seen any report coming out of course, CPCB came up with something during the lockdown period, but we've not seen an evaluation of the NCAP from MOFCC or CPCB in the last 5 years. So I would love to see that, honestly, because I want MOFCC and CPCB to open at least a dialogue where, we can, yes, there are issues with data quality, but can we at least have a conversation around it? So I think that would be a great first step. The second piece, and I think we've alluded to this partially in sort of the earlier interventions, is funding. If you try to plot funding utilization and air quality improvement seen across cities, there is absolutely no pattern, which is bizarre, because greater funding utilization should honestly translate into better action in cities and better improvement. But we don't really see that. So more transparency around where money is really going. We have information on what percentage of funds is being used, but where those funds are being used, we have no information around that. And some group, if we have to put together an analysis like that, some group will have to, go all guns blazing with RTIs to collect information around it, which probably is not the best way to curate a study like this. So information around where cities are really spending money, so that at least we can see, what kind of initiatives are translating into air pollution reductions and what kind of initiatives are frankly wasteful. And third, a point that I've been harping from the very beginning, and also very similar to what Sunil was saying around better monitoring and evaluation practices for specific policy interventions. We need to build a culture to pilot and test out policy regulatory interventions, not solutions like smoke tars, which practically have no evidence around their efficacy. But regulatory interventions which have worked elsewhere, can they be piloted and robustly evaluated in the Indian context, is what I'm talking about. So 3 points there. Government opens a dialogue around whether NCAP has worked or not. Contextualizing funding utilization, where really is the money going, transparency around that. And third, creating a culture of piloting and evaluating regulatory interventions.
Thank you, Tanushree. With that, we've come to the end of this fascinating discussion. And thank you to all our panelists for their invaluable inputs. I would also like to thank the audience for asking such pertinent questions and making it more interactive. Once again, I extend my appreciation to Chintan and to Bharti for collaborating with us on this webinar and fostering a discussion on this critical topic. Thank you so much.
Thank you, everyone. I know before I let you go, I thought I'd just very briefly, like in 2 minutes, just put out this thought, particularly because there are other people. And I think if we really said something as a panel today, it was really 3 Ds, right? I mean, there's data, which should be hyperlocal, it should be transparent, and it should be used to monitoring policies. The second D would be Delhi. It is not the center of the universe. We're seeing new places, whether it's Bhagalpur or Bombay or Mumbai. And we really have to recalibrate our approach. Not everyone's there. And then there's the third D, which is decisions, which is really about, I really liked how Sunil Daya said this, because he said that, you just have to take a decision and say, no, we just won't allow all these vehicles. And actually, Sunil, Delhi is experiencing that, right? Because we turned to CNG, a few decades ago, and we were so smug. And then we had 1,000 vehicles every day added on our roads. And here we are today, so unwell. And I think we should learn also from the past. So there's that about taking decisions to say no. There's decisions about, getting along politically and administratively, if only, to invest in our economy and not make us close down factories and, reduce human productivity, all of which then dents the economy. And I guess the third part would be really about making fast decisions on new polluted areas which aren't currently a part of that landscape of NCAP. And with that, I'm just going to close at least my remarks. And thank you for making the time. Like I said, today is not the kind of day we normally imagine us sitting indoors and talking air pollution, but it's the need of the hour. So thank you. I also want to thank Amba. Amba, you've been really incredible. CSDR has put all of this together much more than Chintan. And I hope we'll continue having all of these conversations because, we just can't have one. And we really have to think harder, think deeper, and think with a wider community.
Yes, I agree with you. And we really look forward to more collaborations with you and facilitating such conversations in the future.
Absolutely. So thank you, everyone.
Thank you. This is fun. Thank you so much.
Thanks, Amba. Thanks, Swati. Thanks, everyone. It was
Thank you.
a pleasure
Thank
being
you.
part of this.
Thank you.
Bye, Dr. Shekhar.
Thank you. Bye-bye. Bye, Bye.
Bye.